Let's get to work, and thank you all very much for being here. And we want to thank C-SPAN for covering this important hearing. And I especially want to thank our witnesses, some of whom have traveled from very long distances from around the world to be with us today. We very much appreciate your being here. The United States has, I think, a very effective form of government in the sense that we are a federalist system, which means that we have 50 separate states, and it is very common that one state learns from what another state is doing. So every day in California or North Carolina or Vermont, somebody is coming up with an idea or a program. It works. Other people steal those ideas, learn from those ideas, and that's, I think, a pretty effective way of going forward. I do not believe that we utilize that practice as much as we should internationally. The United States is not the only country on earth. There are other countries that are doing very positive, interesting things, and we should be learning from them. And in a sense, that's what this hearing is about, is to see what we can learn from other countries around the world in terms of healthcare. And in my view, in fact, we have a whole lot to learn. Because at the end of the day, the United States spends far more per capita on healthcare. We spend almost twice as much per person on healthcare, and yet we have many millions of people who are uninsured, and our healthcare outcomes, compared to many other countries, are not particularly good. And that's my starting premise. Why is that? And what can we learn from other countries who in many ways are doing better than we can? So let me start off with just a couple of basic facts about the American healthcare system. While it is absolutely true that some Americans, often those with a lot of money, receive some of the best cutting-edge healthcare in the world, it is also true that for millions of low and moderate income Americans, they have little or no access to even the most basic health care services. And later on, I think maybe as part of the questions or answers, we're going to show a photograph that many of you have seen of in Virginia or California, people lining up in fields to get basic health care or to get their teeth, rotted teeth, extracted, photographs that would remind you of a third world country. The reality is that today, the United States is the only major country on earth that does not guarantee health care as a right. And that is a basic philosophical debate that we have to have. Should all Americans, regardless of their income, have access to health care as a right or not? The United States is the only nation in the industrialized world that says, no, you're not entitled to health care as a right. In 2012, more than 15% of our population, nearly 48 million Americans, were uninsured. But that's only half the story, because many people who had insurance also had high deductibles and high co-payments. And those payments created situations where people hesitated to go to the doctor when they should. Not to mention other people leaving hospital deeply in debt and going bankrupt. Is that something that we are proud of? Here's another important point to be made. We talk about rationing and so forth. Of course, in the United States, healthcare is rationed, but it is rationed by ability to pay, by income. According to a Harvard study published in Health Affairs 2009 and Health Affairs in 2014, some 45,000 Americans die every year because of a lack of access to health care. And I have talked to doctors. I don't know if my colleagues in their states have talked to doctors. I have talked to doctors who say, yeah, people walk in the door and they are now terminally ill. And the doctor said, why didn't you come in here 6 months ago? Why didn't you come in here a year ago? And people say, well, I didn't have any health insurance. I didn't want any charity. I thought I would get better. So we're losing some 45,000 people a year because they don't get to a doctor when they should. There are, furthermore, communities around this country. I know Senator Roberts of Kansas mentioned this in a hearing we had a while back, where there are no doctors. There are towns in Kansas, no doctors in the area at all. People do not have access to basic primary care. Now, despite all of that, the United States, as I mentioned a moment ago, spends almost twice as much per capita on health care as does any other country. We are spending about 18% of our gross domestic product on health care, compared to 11 to 12% in France, Germany, Denmark, and Canada, 9% in the UK, Australia, and Norway, and less than 8% in Taiwan and Israel. And we're going to hear a representative from Taiwan in a few minutes. In terms of efficiency, are we an efficient system? Compared to the huge amount of money that we're spending, are we getting good value? In August 2013, Bloomberg, a respected business source, ranked the United States healthcare system 46th of 48 countries based on efficiency. Now, what about outcomes? You know, if I'm spending $100,000 on a car and somebody's spending $20,000 on a car, we would assume that my car runs better. I'm getting better value. I'm getting value for what I pay for. Well, the United States pays almost twice as much, but in terms of our health care outcomes, we do not do particularly well compared to other countries around the world. Among OECD countries, the United States ranks 26th in terms of life expectancy. Residents of Italy, Spain, France, Australia, Israel, Norway, and the list goes on, will live 2 to 3 years longer than Americans. So in terms of our outcomes, they're not particularly good. What about prescription drugs? Clearly, when we go to the doctors, very often the therapy is medicine. I recall talking to a doctor in northern Vermont who told me that about 25% of the patients that she sees, and when she writes prescriptions for, are unable to fill those prescriptions because they're just too expensive. The fact of the matter is the pharmaceutical industry in this country earns huge profits and charges our people the highest prices in the world for prescription drugs. There's a lot more to be said, but let me end my remarks with those comments, and I look forward to hearing the testimony of our esteemed panelists. Senator Burr.
Thank you, Mr. Chairman, and thank you for calling this hearing. I truly thank our witnesses today for their knowledge and for their willingness to be here to share with us their information. In about 2 weeks, our nation will mark the 4th anniversary